Nobody told me that some dogs choose pain over people for a reason. The white pit bull they dragged through our doors looked like someone tried to erase him, and what I found hidden inside his mouth 3 weeks later explained a horror worse than any of us could have imagined. Stick around, because you're about to see the moment Max finally realizes he doesn't have to fight anymore. If you believe that no dog is ever truly too broken to be saved, hit that subscribe button right now, because stories like this are exactly why we refuse to walk away. The chemical burns covered most of his white coat, leaving patches of angry pink skin where fur used to protect him. A thick chain had been embedded so deep into his neck that we had to cut through the metal with bolt cutters, revealing a groove carved nearly half an inch into his flesh. He weighed 52 pounds, should have been at least 70. But here's what nobody at Midtown Animal Rescue could explain that morning at 6:47 a.m. His eyes were begging for help. I swear I could see it, that desperate plea for someone to make the pain stop. But the second anyone got within 3 feet of him, he'd explode at the kennel bars like we were the ones who tortured him. No barking, no growling, no warning whatsoever, just the silent detonation of teeth and pure terror, followed by this violent retreat to the back corner of his kennel. And he kept doing this thing with his paw, scratching at his mouth over and over and over, like something inside was burning him worse than what we could see scorched across the outside of his body. They named him Max at intake. I don't know why we bother naming them sometimes. It feels like giving hope to something that might not survive the night. Animal Control found him chained behind an abandoned warehouse, half dead, surrounded by his own waste and the stench of neglect. The officer who brought him in was a veteran of these cases, but even he wouldn't meet my eyes when he handed over the paperwork, just muttered, "This one's bad, real bad," and walked out. I'm a veterinarian, been working at Midtown Animal Rescue for almost 9 years now. I've seen dogs come in missing legs, missing eyes, missing half their faces from tumor removals gone horribly wrong. I've held puppies while they took their last breath because someone decided they were disposable. I've stitched up wounds that made seasoned ER doctors turn pale. So, when I say Max was different, I don't mean he looked worse than the others. I mean, something about him felt wrong in a way I couldn't name yet. Like there was a secret trapped inside him that he was dying to tell us, but couldn't. Dr. Callahan did the initial exam from outside the kennel. Getting close wasn't an option with Max. 40% of his body showed chemical burns, the kind you get from industrial acid or heavy-duty cleaning solution deliberately poured on skin, not from accidental fire. The chain had been on him so long it had practically fused with the tissue underneath, creating that horrifying trench around his neck. His ribs jutted through his damaged skin like the bars of a cage. But here's the strangest part that made my gut twist with suspicion. His teeth were absolutely perfect. No signs of dogfighting, no broken canines, no wear patterns from chewing through ropes or desperately gnawing at cage bars trying to escape. For a dog this severely traumatized, that didn't make any sense at all. 3 weeks, Dr. Callahan said, scribbling notes without looking up from her clipboard. Maybe less if the infection spreads to his bloodstream. We're looking at $2,800 minimum just to stabilize him, probably closer to $4,200 if complications develop, which they will. Emergency intake fee alone is $340. She paused, finally meeting my eyes. And that's assuming we can even touch him long enough to start treatment. Right now, he's scheduled for a euthanasia evaluation. The director's already made the call. I looked back at Max, huddled in the corner of that cold kennel, his damaged body trembling. One paw raised to his mouth again, scratching, scratching, scratching at something we couldn't see. His eyes found mine for just a fraction of a second, and in that moment, I knew. He wasn't aggressive. He was protecting himself from something none of us understood yet. And I was about to spend $4,780 of the shelter's money and my own savings to find out what. The intake photos didn't prepare me for what Max actually looked like up close. Animal Control had documented everything with their standard-issue camera, the burns, the chain, the emaciation, but photographs flatten trauma into something you can look at without flinching. Reality doesn't give you that mercy. I stood outside his kennel that first morning, close enough to smell the infection brewing under those chemical burns. The warehouse where they'd found him had been condemned for 3 years, used as an illegal dumping site for industrial waste. Someone had chained Max in the back corner, surrounded by leaking barrels of God knows what. The burns on his face and shoulders had that distinct pattern of liquid poured from above, deliberate, calculated cruelty. He sat perfectly still in the back corner of the kennel, watching me with those heartbreaking eyes. His white coat was mottled with brown and black stains, some from dried blood, some from the chemicals that had eaten through his skin. The groove around his neck looked like something carved by a sculptor with a steady hand and no conscience. Most dogs would have been whimpering, pacing, showing some sign of the pain that had to be screaming through every nerve in their body. Max was silent. Completely, unnervingly silent. I knelt down slowly, keeping my distance, and spoke to him in the soft voice I'd used on 1,000 frightened dogs before. "Hey there, cowboy. I know it hurts. I know you're scared, but we're going to help you, okay? We're going to—" That's when it happened. The silent explosion everyone had warned me about. 1 second he was sitting there, still as a statue. The next second he was hurling himself at the kennel bars with such force that the entire structure rattled against the concrete floor. His mouth opened wide, wider than I'd ever seen a dog's mouth open, revealing those perfect white teeth. But no sound came out. Not a growl, not a snarl, nothing. Just the metallic clang of his body hitting the bars and the horrible silence of his rage. Then, just as quickly, he retreated, scrambled backward into his corner, pressing himself against the wall like he was trying to disappear into it, and raised that paw to his mouth again. Scratch, scratch, scratch. Frantic, desperate. I stood up, my heart hammering. This wasn't aggression. This was panic. Pure, animalistic panic triggered by something specific about my approach, my proximity, or maybe just the fact that I was human. "What happened to you?" I whispered, more to myself than to him. "What are you trying to tell us?" Max didn't answer. He just kept scratching at his mouth, his eyes never leaving mine, as if willing me to understand something that his damaged body couldn't communicate any other way. The euthanasia evaluation was scheduled for Friday afternoon, 3 days away. That's how long Max had to prove he wasn't a liability, that he could be handled, treated, and eventually rehabilitated. 3 days to convince the shelter director that he was worth the money, the risk, and the kennel space we desperately needed for more adoptable cases. I knew the math before I even walked into Director Chen's office. We were a nonprofit running on donations and grants that barely covered our monthly operating costs. Every dollar spent on Max was a dollar we couldn't spend on the pregnant stray that came in yesterday, or the senior lab mix with the tumor on his leg. The shelter had a responsibility to help as many animals as possible, and sometimes that meant making impossible choices. "You can't even get close enough to put a leash on him," Chen said, not looking up from the budget spreadsheet on her computer. "Dr. Callahan says he's a bite risk, severe, the kind that gets us sued and shut down if something goes wrong." "I think he's in pain," I said. "I think whatever's making him aggressive is medical, not behavioral." "Everything's medical with you." She finally looked at me, and I could see the exhaustion in her eyes. She'd been doing this job for 15 years, making these calls over and over. "We've already spent $340 on intake. Emergency antibiotics for the infection are another $180. Wound care supplies, pain management, kennel isolation protocols. We're at $890 before we've even started real treatment." I'd done my own math on the walk to her office. IV antibiotics for potential sepsis, $620. Surgical debridement of the burns, $1,200. Pain medication for 4 weeks minimum, $340. Follow-up visits, blood work to monitor organ function from the chemicals, specialized wound dressings. I trailed off. "We're looking at $4,200, maybe more." "And that's assuming he lets us treat him," Chen said, "which he won't. So we sedate him, which adds another $280 per session, and increases the risk of complications with his compromised system. The silence stretched between us. Outside her office, I could hear the usual shelter symphony: barking, the clatter of metal bowls, volunteers laughing with the dogs in the play yard. Normal, adoptable dogs. Dogs that didn't come with a 4-figure price tag and a lawsuit waiting to happen. "I'll take the case," I said. "Personally, I'll cover anything over the emergency budget, and I'll handle all the direct care. If something goes wrong, it's on me." Chen leaned back in her chair, studying my face like she was trying to figure out if I'd finally lost it. "You can't afford that. I know what we pay you." She was right. I couldn't. But I also couldn't walk past Max's kennel every morning and watch him scratch at his mouth, begging us to understand something we were all too blind to see. "Cancel the evaluation," I said. "Give me 3 weeks. If I can't figure out what's wrong with him by then, I'll make the call myself." Chen sighed, and I knew I'd won. 3 weeks, not a day more. Max didn't eat for the first 4 days. Not a single bite. I'd tried everything. Premium wet food at $4.80 a can, the kind we usually reserved for post-surgery recovery cases. Boiled chicken breast shredded into tiny pieces. Ground beef mixed with white rice. Even baby food, the bland turkey flavor that usually worked on the most reluctant eaters. I'd slide the bowl into his kennel using the long-handled tool we kept for aggressive cases, then back away and watch from across the room. Every time, the same response. Max would stare at the food like it was a threat. His whole body would go rigid, that paw would come up to his mouth, and he'd start scratching. Frantic, desperate scratching that sometimes went on for minutes at a time. Then he'd retreat to his corner and turn his face to the wall, as if the sight of food caused him physical pain. "He's going to starve," Sarah, one of our senior techs, said on day 5. She'd been working at the shelter longer than I had, seen more lost causes than either of us wanted to count. "His body can't handle this. Not with those burns, not with the infection we're fighting. He needs calories, or his organs are going to start shutting down." I knew she was right. Max had already lost another 3 pounds since intake. His ribs were even more pronounced now, his hip bones jutting out like handles. But every attempt to sedate him for forced feeding triggered that silent explosion of terror, and I couldn't bring myself to add more trauma to whatever hell he'd already endured. That night, I stayed late. The shelter was quiet, except for the occasional bark or the sound of dogs shifting in their kennels. I pulled a chair up about 6 feet from Max's cage and just sat there, watching him in the dim emergency lighting, trying to understand. He sat in his usual corner, perfectly still except for his eyes tracking my every movement. After about an hour, he slowly turned his head toward the untouched bowl of food I'd left that morning. His nose twitched. I could see him salivating. His body was desperate for those calories, screaming at him to eat. Then, he lifted his paw to his mouth again. But this time, instead of scratching, he did something I'd never seen before. He pressed his paw against his muzzle and held it there, like he was physically holding his mouth shut. His whole body trembled with the effort of restraint, and in his eyes, I saw something that made my blood run cold. Fear. Not of me, not of the food. Fear of what would happen if he opened his mouth. He held that position for almost 30 seconds before the trembling became too much and he collapsed onto his side, panting. The food stayed untouched, and I finally understood that whatever was hidden inside Max's mouth wasn't just causing him pain. It was the reason he'd rather die than let anyone help him. I made the decision on day 7. Max had gone a week without eating, and his body was starting to shut down. His gums had turned pale, his eyes were sunken, and when I checked the logs, his last recorded water intake had been over 30 hours ago. We were past the point of patience and observation. If I didn't get fluids and nutrition into him within the next 24 hours, I'd be making that call to Director Chen myself. The plan was simple. I'd move slowly, keep my body language non-threatening, and get just close enough to slip a leash around his neck. Once secured, we could sedate him safely and start emergency treatment. Sarah thought I was insane. Doc Callahan refused to be in the room when I tried it, But I'd spent 7 days watching Max, learning his patterns, and I genuinely believed I could do this without triggering that explosive panic. I was wrong. I opened the kennel door slowly, speaking in that same soft voice I'd been using all week. "Hey, cowboy, it's okay. I'm just going to help you, that's all. Nice and easy." Max pressed himself against the back wall, his whole body tensing. That paw came up to his mouth, trembling. I took one step inside, then another. 12 inches into the kennel. That's as far as I got. He launched himself at me with a speed I didn't think his weakened body could manage. I saw his mouth open wide, saw those perfect white teeth, and then felt the impact as his jaws clamped down on my forearm. The pain was immediate and electric, shooting up my arm and into my shoulder. But I didn't pull away. Couldn't. Because in that split second before the shock took over, I saw something that made everything else disappear. Metal. A glint of metal deep in his mouth, wedged between his back molars on the left side. "Don't move!" Sarah was screaming from outside the kennel. "Jesus Christ, don't move!" But I was barely breathing, barely processing the blood now seeping through my sleeve. Max had frozen too, his jaws still locked on my arm, but not biting down harder, like he'd made his point and didn't know what to do next. His eyes met mine, and in them I saw something that broke my heart all over again. Shame. He was ashamed. "It's okay," I whispered, my voice shaking. "It's okay, Max, I know. I know now. There's something in there, isn't there? Something you can't get out." Slowly, carefully, I pulled my arm back. Max released immediately, retreating to his corner and beginning that frantic pawing motion again. Scratch, scratch, scratch. I stumbled out of the kennel, cradling my bleeding arm. Sarah was already on me with gauze and antiseptic, but I pushed past her toward Dr. Callahan's office. "We need to get him under anesthesia," I said. "Right now. There's metal in his mouth." "You need stitches," Sarah said. "That's a reportable bite. Protocol says—" "There's metal embedded in his gums," I said again, louder this time. "That's why he won't eat. That's why he won't let us near him. Someone put something inside his mouth, and we need to get it out before it kills him." Dr. Callahan didn't believe me. Not at first. "You saw metal during a traumatic bite incident," she said, cleaning the puncture wounds on my arm with methodical efficiency. "Your brain was flooded with adrenaline. The lighting in that kennel is terrible. You could have seen a reflection, a shadow, anything." "It was metal," I insisted. "I know what I saw." But protocol required a behavioral assessment before we could proceed with anesthesia, especially after an aggressive bite incident. So they called in Marcus Webb, the animal behaviorist who consulted for 3 different shelters in the county. He arrived the next morning with his clipboard and his 20 years of experience and spent 45 minutes observing Max from outside the kennel. His diagnosis was immediate and confident. "Classic bait dog," he said, making notes without looking up. "The chemical burns, the embedded chain, the food refusal, the defensive aggression. I've seen this pattern dozens of times. They use smaller dogs as practice for fighting dogs, keep them restrained so they can't fight back effectively. The trauma creates severe PTSD. He associates any human interaction with pain and imminent death." "But his teeth are perfect," I argued. "No wear, no breaks. If he was a bait dog, wouldn't there be—" "Not if they kept his mouth restricted during the fights," Marcus interrupted. "Some handlers use muzzles or wraps. Keeps the bait dog from doing any real damage while the fighting dog learns to kill." He closed his notebook. "My recommendation is humane euthanasia. Dogs with this level of trauma rarely rehabilitate to the point of being safe for adoption. The kindest thing you can do is let him go." I felt something cold settle in my chest. "We need to sedate him. Examine his mouth properly." Marcus shook his head. "Sedation will likely make the behavioral response worse when he wakes up. These dogs often experience increased anxiety and aggression after being chemically restrained. It mimics the helplessness they felt during the abuse." But Director Chen had heard enough about my metal theory to authorize one attempt. "If there's something in there, we need to know," she said. If there isn't, we move forward with Marcus's recommendation. They sedated Max that afternoon. It took 3 of us and a catch pole, and even drugged, he fought like we were killing him. When he finally went under, his body continued to twitch, his paw making that same scratching motion even in unconsciousness. I expected the sedation to give him peace, to give us all time to work without his terror complicating everything. Instead, when Max woke up 3 hours later, something inside him had shattered. The frantic pawing at his mouth became constant, obsessive. He wouldn't stop. Even when his paw started bleeding from the repetitive motion, he kept going, scratching and scratching until Sarah had to wrap his paw just to prevent more damage. Marcus was right about one thing. The sedation had made everything worse. But he was wrong about why. Max wasn't traumatized by helplessness. He was terrified because that metal was still in his mouth, and now he'd lost 3 more hours to get it out. I couldn't sleep that night. Kept seeing Max's wrapped paw, the blood seeping through the bandage from hours of obsessive scratching. Kept hearing Marcus's confident voice saying, "Humane euthanasia," like it was the only logical conclusion. We were on day 9. I had 12 days left before Director Chen pulled the plug, and I was no closer to proving that Max could be saved. At 2 a.m., I gave up on sleep entirely and drove back to the shelter. I had an idea, probably a desperate one, but I was running out of options. I'd borrowed a Furbo camera from one of the volunteers, the kind people use to watch their dogs from work. If I couldn't be in the kennel with Max without triggering his panic, maybe I could watch him when he thought no one was looking. See what he did when the terror of human presence wasn't overriding everything else. I set up the camera in the corner of his kennel during feeding time, angling it to capture his water bowl and the food we'd left. Max watched me from his usual spot, that wrapped paw already coming up toward his mouth before stopping, confused by the bandage. I left quickly, before he could work himself into another frenzy. Then I went home, opened the app on my phone, and watched. For the first hour, nothing. Max sat perfectly still, staring at the water bowl like it was an enemy. His body language screamed thirst. His tongue kept darting out to lick his dry nose. His breathing was shallow and rapid. But he didn't move toward the bowl. At 3:47 a.m., something changed. Max looked toward the kennel door, as if confirming he was truly alone. Then, slowly, painfully, he stood up. He approached the water bowl with the caution of someone approaching a bomb. And then he did something that made me sit straight up in bed. He lifted his wrapped paw, dipped it into the water bowl, and brought it to his mouth. Let the water drip from the bandage onto his tongue. Then dipped again. And again. Drinking in tiny amounts, never opening his mouth wide enough to submerge his muzzle in the bowl like a normal dog would. I watched him do this for 20 minutes, this awkward, painful process of hydration that should have taken 30 seconds. And with each dip of his paw, I felt the pieces finally clicking into place. Max wasn't refusing water because he wasn't thirsty. He was refusing to put his mouth in the bowl because something in there, that metal I'd glimpsed, made contact with water unbearably painful. Or maybe dangerous. Maybe whatever was embedded in his gums was positioned in a way that opening his mouth to drink or eat caused the metal to shift, to cut, to dig deeper into tissue that was already infected and inflamed. He wasn't aggressive. He wasn't traumatized beyond repair. He wasn't choosing pain over people. He was protecting himself the only way he knew how, and we'd all been too blind to see it. I grabbed my keys and headed back to the shelter. We were doing that oral exam, whether Marcus Webb agreed or not. Because Max had just shown me he wanted to survive. He just needed someone to finally understand what he'd been trying to tell us all along. Dr. Callahan scheduled the oral surgery for 6 a.m. before the shelter officially opened. She didn't say it out loud, but I knew why. If we found nothing, Marcus's euthanasia recommendation would go into effect immediately. No more delays, no more expensive gambles on a dog that couldn't be saved. Sarah prepped the surgical suite while I helped sedate Max one more time. He fought us even harder than before, that wrapped paw thrashing as the drugs took hold. "I'm sorry," I whispered, as his eyes finally glazed over. "I'm so sorry, but this is going to help, I promise." Dr. Callahan worked quickly once he was under. She inserted the mouth speculum to hold his jaws open, adjusted the overhead light, and leaned in with her examination mirror. I stood across from her, hands already gloved, holding the suction tube in case we needed it. "Jesus Christ," she breathed, and I knew I'd been right. "What is it?" She didn't answer, just gestured for me to look. I moved closer, angling my head to see into Max's open mouth, past those perfect white teeth, into the soft tissue of his gums. There, embedded deep in the flesh on both sides of his lower jaw and one on the upper palate, were 3 metal hooks. Not fishing hooks, these were worse. Surgical-grade steel, curved and barbed, designed to anchor into tissue and stay there. Someone had deliberately implanted them, probably while Max was sedated or restrained, positioning them so that any normal jaw movement would cause them to pull and tear at the surrounding tissue. "Bait dog modification," Dr. Callahan said quietly, her voice tight with rage. "They embed hooks in the mouth so the dog physically can't bite down during fights, keeps them defenseless while the fighting dogs practice their kill technique. The hooks make it too painful to close their jaw with any force." I felt sick. No wonder Max had refused to eat. No wonder he'd launched himself at me when I got close. Every time someone reached for him, he anticipated another insertion, another hook, another piece of hardware forcing him into helplessness. "How long have these been in?" I asked. "Based on the scar tissue and infection? Months, maybe longer." She was already reaching for her extraction tools. "The gum tissue has tried to heal around them multiple times, but the constant movement keeps reopening the wounds. He's been living with active infection in his mouth this entire time." The extraction took 40 minutes. Dr. Callahan worked with painstaking care, cutting away the infected tissue that had grown around each hook, then carefully removing the barbed metal from his gums. Each hook came out with a soft, terrible sound, metal scraping against bone. I placed them on the surgical tray. 3 pieces of steel that had turned Max's mouth into a prison. 3 reasons why he'd chosen starvation over submission. 3 pieces of evidence that someone had deliberately engineered his suffering. "He wasn't aggressive," I said, staring at those hooks. "He was terrified we were going to add more." Dr. Callahan nodded, already suturing the extraction sites. Every hand that reached for him was a threat. Every person who tried to help looked exactly like the person who did this to him. For the first time in 9 days, Max's mouth was his own again. Max woke up from surgery different. Not healed, that would take weeks, but different in a way I couldn't quite articulate at first. When his eyes opened and found mine across the recovery room, he didn't immediately retreat to the back of his kennel. He just looked at me. Confused, maybe. Cautious, definitely. But not terrified. The real change came 2 days later when he finally ate. Not much, just a few bites of soft food that wouldn't require him to chew. But he ate. And for the first time since he'd arrived at Midtown, he put his mouth directly into the water bowl and drank like a normal dog. Sarah actually cried when she saw it on the kennel camera. But eating wasn't the same as trusting. Max had spent months learning that humans were the source of his agony, and 3 surgically removed hooks didn't erase that association overnight. He still wouldn't let anyone touch him, still pressed himself against the back wall whenever someone approached. The terror was quieter now, more manageable, but it was still there. I started spending my lunch breaks in his kennel, not trying to pet him or force interaction, just sitting on the floor 6 feet away, eating my sandwich while he watched me from his corner. Sometimes I'd talk to him about nothing in particular. Sometimes I'd just sit in silence. The goal wasn't progress, it was presence. I needed him to learn that humans could exist near him without causing pain. On day 16, I brought in a doggy lawn, one of those fake grass patches we used for small dogs who couldn't go outside. Max had been holding his bladder for dangerous lengths of time, too anxious to relieve himself with people watching. The lawn gave him privacy and a sense of normalcy. He used it immediately. And when he finished, he looked at me, really looked at me, for the first time without fear in his eyes. Just curiosity, like he was trying to figure out what kind of human would care about his comfort without demanding anything in return. I started counting. 3.2 seconds of direct eye contact before he looked away. It doesn't sound like much, but for a dog who'd spent weeks avoiding human gaze as if it could kill him, 3.2 seconds was everything. The breakthrough came on day 19. I was sitting in my usual spot, scrolling through adoption applications for other dogs, when I felt something touch my leg. I looked down and found Max standing beside me, his body still tense and ready to bolt, but close enough that his shoulder brushed against my knee. He didn't want to be petted, didn't want me to reach for him. He just wanted to be near someone without pain being the inevitable result. So I didn't move, barely breathed. Just let him stand there, making his own choice for maybe the first time in his life. We stayed like that for 11 minutes. I know because I watched the clock on the wall, afraid that any movement would break the spell. When Max finally walked back to his corner, he didn't curl up facing the wall like usual. He lay down facing me, rested his head on his paws, and closed his eyes. Not sleeping, but resting, trusting just a little that he might be safe. Natalie came to the shelter on a Saturday morning in late spring, 3 months after Max's surgery. She was 8 years old, wearing a sundress and carrying a stuffed dog under her arm. Her parents had explained that they were just looking, not ready to commit to anything yet. I'd heard that line 1,000 times before, but Natalie walked straight past the kennels full of jumping, barking, tail-wagging dogs that were actively campaigning for adoption. She stopped in front of Max's kennel, where he sat in his usual corner, watching the weekend chaos with wary eyes. "That one," she said simply. "He looks like he needs a friend." Her mother looked at me with concern. "Is he safe with children?" I could have explained Max's history, the hooks, the trauma, the months of rehabilitation. Could have listed all the reasons why a family with a young child might want to choose an easier dog. Instead, I knelt down next to Natalie. "Max has been hurt really badly," I said. "He's learning to trust people again, but it takes time. You'd have to be very patient with him, very gentle." Natalie nodded seriously, like I'd just given her an important job. "I can do that. I'm good at being gentle." Something made me open the kennel door. Max didn't retreat this time. He'd stopped doing that weeks ago, but he didn't approach either. Just watched this small human with the kind of cautious curiosity he'd started showing me. Natalie sat down on the floor, cross-legged, and waited. Didn't call to him, didn't reach out, just waited. And after a long moment, Max stood up and walked over to her. Not close enough to touch, but closer than he'd voluntarily gotten to any stranger since he'd arrived. "Hi, Max," Natalie whispered. "I'm Natalie. Do you want to come live with me?" Max's tail, which we'd barely seen move in 3 months, gave a single, tentative wag. The adoption paperwork took 2 weeks. Home visits, background checks, extensive conversations about Max's needs and limitations. But Natalie came to visit him 3 times during that period, each time sitting patiently on the floor until Max decided to come closer. By the 3rd visit, he was resting his head on her knee. The day they came to take him home, Natalie brought a present, a straw hat with a blue ribbon, just like the one her stuffed dog wore. "So he knows he's part of the family," she explained. I helped Max into their car, his new blue t-shirt already on. Natalie had picked it out specifically for him. As they drove away, I caught one last glimpse of him in the back seat. The straw hat was perched awkwardly on his head, and for the first time since that morning at 6:47 a.m., when they dragged him through our doors, Max was smiling. Not the nervous panting we'd seen during his recovery, an actual, genuine dog smile. 3 months ago, he'd been a ghost in a kennel, choosing pain over people because pain was all he'd ever known from us. Now he was just a dog in a straw hat, going home with a girl who saw past the scars to the soul underneath. And that was worth every penny of the $4,780 I'd gambled on him.